Psychological health is the cornerstone of successful careers, marriages, effective child-rearing, and even physical health. At one or more points in everyone's life, however, their psychological well-being will be challenged. Welcome to the ICISF Quick Tips series. In this episode, we're discussing a groundbreaking approach to providing psychological support for our heroes in emergency services. While strong connections with friends and family are vital for mental well-being, sometimes that's not enough. And despite gallant efforts, we have failed to provide adequate access to mental health services even in the best of times. In addition, we have failed to remove the stigma associated with seeking mental health services. Perhaps it's time for a seismic shift in training and practice. In 2006, while at Johns Hopkins Center for Public Health Preparedness, Dr. George Everly Jr. authored a paper calling for the expansion of psychological support services using providers other than mental health clinicians. He later expanded this notion in papers authored in 2019 and in 2023. He referred to this approach as Peer Paracounseling.
I've proposed the creation of a new role in the functional integration of psychological healthcare. The term I use to describe this new role is Peer Paracounseling. Peer Paracounseling is not the practice of professional counseling. Rather, it is the psychological analog of community paramedicine. Peer Paracounseling may be envisioned as the functional integration of three processes. First, subacute psychological first aid. Secondly, Alan Ivey's micro-counseling techniques. And third, Cherie Castellano's reciprocal peer support. But in the final analysis, it's really a form of coaching based in Albert Bandura's social learning models. It's specifically designed to be implemented by those without other formal training in mental health.
So, what is the goal of Peer Paracounseling?
Peer Paracounseling is an advanced set of skills intended to foster human resilience. It does that by filling the gap between acute emergent crisis intervention and extended counseling and psychotherapy. It completes the critical incident stress management peer support continuum of care, but it does require advanced training. While originally intended for the emergency services, Peer Paracounseling may be used to expand psychological support to a wide array of peer groups, such as healthcare providers, educators, military veterans, airline and other transportation professionals, corrections personnel, and even clergy. Peer Paracounseling could even be considered a useful managerial skill. It could be useful for anyone in a leadership position. It can even be implemented in the community mental health setting in general, but especially in the wake of disaster.
Today, we've explored Peer Paracounseling as a powerful tool to strengthen mental health and, in turn, society. The United Nations emphasizes the critical link between mental well-being and the fabric of society. Peer Paracounseling serves as a lifeline and a bridge, offering hope and guidance for individuals in need, ultimately contributing to a more resilient and compassionate society. Thank you for listening to this episode of the ICISF Quick Tips series. You can learn more about Peer Paracounseling by taking our virtual course, Crisis-Informed Peer Paracounseling, Intervention Enhancement to the CISM Continuum. Visit our virtual training page at icisf.org/remote-learning for information and to register today.